Congrats on graduating dental hygiene school. It is now time for you to transition from RDH student to RDH professional. So let's talk about what you can do to have a successful first day of work. Hi, my name is Whitney and I'm a dental hygienist here to talk about tips for a successful first day of work as a new RDH graduate. If you want to learn even more about the dental hygiene career, I have a free RDH video checklist on how to become an RDH and how to navigate life as a new RDH grad. So no matter where you are on your RDH journey, I'll link below my free RDH video checklist for you to learn everything there is about this amazing dental hygiene career. And having said that, let's talk about the question I get in a lot of my YouTube comments. Whitney, tell me about your first day on the job as a dental hygienist. People ask me all the time, like, how did it go? What should I expect on my first day? So I thought through telling you my experience, it can help you with your experience. So I'm going to tell you my story about my first day, and I'm sure you're already aware that every office and every situation is going to be different, but this will still hopefully give you an idea of what to expect and how to make it go smoothly. So keeping that in mind, here's my story. On my first day of work, I was very nervous, mostly about my speed because I knew I was slow in the beginning, and it's fine. I got through it like anything, right? You're always slower when you first start new things, and then you get fast because you get more confident and proficient over time. You learn the office flow, how things go, and you start vibing with the time limits. My best words of wisdom are to remember, you already have the skills you need. You got this. Truly, practice makes perfect. In this situation, I believe it more than ever. You already have the skills. You learned them in clinic and school. You've used them. Now you just have to get used to using them in a different setting. But yes, back to my story time. My first ever patient was a new patient, which I think was great because a new patient has no expectation of you. You know, there's no one to compare you to. It's their first time at your office. So I liked having a new patient. I thought that was great. However, I do remember feeling really stressed about how and when they fill out their medical history form. Sounds so silly, but I saw when they walked in and I was like, oh, how will I know when they're ready for me to come get them from the waiting room? So I think that's one of the first questions you should ask your dentist and or office manager or another hygienist that works there. Ask, first of all, how do you know that your patient has arrived in the case that the office is set up in a way that you can't see the waiting room? And how do you know if they finish filling out their health forms and are ready for you to bring them back? Some offices might have a messenger system and the reception types and sends a message to your op saying something like patient is here, patient is ready. Those messaging systems are great. So just figure out what the communication is on how and when to bring your patient back. Because I remember sitting in my op being like, I think they will tell me when they're here. Why didn't I just go up and ask the front desk? Because I was nervous. I could have just went up and said, like a normal confident person would, hey, let me know when my patient is ready. You know, I could have asked. But instead, I sat in my op, twiddling my thumbs, worrying if I should ask or not. I never want to bother anyone. I don't know. I'm just always anxious. So yeah, that's me. But my best advice is if you don't know, just ask. And also, just so you know, depending on which scheduling system dental office uses, on the patient's name, the front desk will sometimes have the ability to mark a little dot next to the name to turn either say green if they are here or red if they are late. So ask that question. How do you know when the patient is ready? Also ask, do I just go up there and call their name to seat them or will I be notified? Just find out what the office protocol is and what they want you to do. I do remember I was waiting. I assumed, or I put in my mind that once the patient forms were scanned in, then I would seat them. I was just like waiting. I kept checking the smart doc, you know, to see if the medical history was in there yet, but it wasn't showing up. So then I finally asked the front desk and they were like, oh, we don't always scan them in right away. You just have to come up and read them physically. I was like, oh, okay, good to know. That works. Yeah, that makes sense. But listen, if you get nervous like me, you don't ever want to ask anything, just do it. Just ask the question. It will be worth it. No one will ever be mad at you for asking a question. So that's my biggest thing. Figure out how you're bringing the patient back. That's number one. Another tip number two, my first ever patient was a new patient. And then my second patient was a returning patient, but it was a child, which was also really cool because kids don't have too many expectations. I mean, some do. Some will be like, I want to see Mallory or whatever. But this particular kid did not care. He didn't know what was going on. So that was helpful. He was just like, hello. And I was like, hello, I'm Whitney. And he was like, hi. And it was very easy. a very easy intro. But I do remember being a little bit nervous when I saw it was a kid because talking to the parents was always the most stressful part for me at the beginning. But something to keep in mind and keep reminding yourself is that confidence is key in this profession and probably in a lot of professions. The thing is about dental hygiene though is that you know what you're doing. Remind yourself, you graduated from dental hygiene school, you passed boards, you've cleaned all the different types of teeth in clinic and school. So don't be nervous about this new environment. It's just a new location to do what you've already been doing. And another tip number 3 is after I got hired, before my first day, I actually shadowed one of the hygienists, a coworker of mine, before I started working. I cannot recommend this enough. It was extremely helpful to see where she went for the instruments and what drawers and cabinets and where certain things were located, and just to hear how she phrased certain things when talking with the patients. My boss actually recommended that I do this. She was like, hey, you should consider coming in before you start just to see how the office flows. And it was the best advice ever. I will always ask to do this when getting hired at a new office. It really gives you a good idea of what to expect. And also, it helped me to not need to ask unnecessary questions on my first day because now you are starting to see that I'm really weird about talking to people if I don't need to. So shadowing really helped me soak in all of the stuff so I knew what was happening kind of before I started working there myself. And then I wasn't like clocking in on my first day without knowing where anything was, you know? Shadowing really helped me find out where most things were located, where the gloves were, where the masks were, you know, so I didn't have to ask if I needed a new box of gloves. I already knew where the storage closet was. I just think it's helpful to be able to get things yourself and handle that type of stuff so you can save your energy to ask more important questions. In my opinion, things like, what's this x-ray look like to you? You know, like medical dental questions instead of asking where the prophy paste is located. I don't know. I'm just personally always trying to limit that. It's so weird, but that's me. Like I mentioned earlier, there's nothing wrong with asking lots of questions on your first day. I'm just telling you my story. I'm just someone who gets extra anxious knowing I have to ask a bunch of questions. So it was really great to do that shadowing day to limit the amount of questions I was going to need to ask on my first day. Shadowing after I got hired, before I started working, really made me feel extremely comfortable. Another note on that, feel free while you're shadowing the hygienist to be like, hey, I know I'm shadowing you, but I'm also going to just walk around and check all the drawers and cabinets to see where things are. Look at the storage room. Check out how they set up their patient trays so you know what's on the tray ahead of time. It's really just a helpful day to make you feel more confident, to see how the sterilization room flows, especially if you're a nervous wreck like me. Knowing where things are ahead of time and seeing how the office flows immensely boosted my confidence. The next tip number 4, is that it's good to find out ahead of time how you are supposed to ask the dentist for exams. I've worked in polar opposite offices on how they prefer for us to ask for exams. It usually just comes down to what the doctor prefers, and if the doctor is someone who doesn't care how you ask for exams, then I'm someone who listens to what the other hygienists do, so I'll just do what they do because I know that the doctor's already comfortable with that. I just try to make everything smooth, you know? Once I'm hired, I don't want to stand out. My resume stood out, I got the job, now I just want to do a good job and keep to myself. I found that it's always a great thing to not be an obnoxious hygienist. I'm all about going with the flow the best I can and all is good. One of my bosses once called me her most peaceful employee, and I'll never forget that. That made me feel great. Peaceful employee, I'll take it. For example, at my current office, we used to have a messaging system where we would message the doctor, ready for exam, and we would type it into the computer. But now we've expanded, so it's a larger practice, and now the protocol is that we physically stand outside the doctor's room and make eye contact with the assistant, and then the assistant has a code to tell the doctor that we're ready. So the assistant sees me standing there and she says something like HC3, which is hygiene check room 3. So then the dentist knows which hygienist is ready. Another office that I temp at, we literally just walk past the dentist's op and say, ready for an exam, something like that. The dentists want to hear it come from you at that office. So it just depends. So ask what they want, how they want to be informed that you're ready for an exam. That's always good to know. And also piggybacking off that, also ask if you think your patient is about to be an SRP or a different type of cleaning, ask how they want you to proceed with that. So at my one office where I just do the eye contact thing with the assistant, I don't want them to give the code that I'm ready for an exam if I think it's an SRP because I haven't even started the cleaning yet. So I need the dentist to come in and collaborate with me and talk about the x-rays and perio charting, all that stuff ASAP before I start, you know? So in that case, they like us to write a little post-it note and I hold it up in the doorway for the assistant to see, and then the assistant knows which code to say out loud to the dentist, because then the dentist knows it's not just a regular exam. It's like a please get in there fast for the assessment because the hygienist needs to know whether or not she can proceed with the treatment. So again, I'm just telling you my stories to give you a feel of what type of things might be out there, but every dentist and every dental office is different. Some dentists may really want to collab with you and look at all the x-rays together first and ask you about the probings and bleedings and everything from your assessment, while other dentists may just want to come in and do their own assessment and say yes or no if they agree with you. Again, just another reason why that observation shadowing day before you start is so helpful, because if you run into one of those situations while you're observing, you can see how your coworkers handle it, because every office is different. Don't forget that. In all, you're going to be fine. You're going to be great, actually. Just feel it out and always be yourself. Try to be true to yourself. Try to be flexible. That's always worked for me. Again, I'm just someone who tends to be very timid and never asks for anything. That does not mean it's right or wrong. It just helps me not be nervous, and it helps me function as a dental hygienist. Having said that, I would suggest that you should never go in there on your first day demanding things, unless of course it's infection control. They're not following proper hygiene standards or something. Of course, always demand proper infection control. But if there's like an instrument you don't love too much that's in their setups, maybe a new scaler that you've never used, I don't think you should ever complain about it right away just because something's not your style. Like, oh, I don't use this instrument, I need this one. I wouldn't do that right away. Give what they have a chance. You'll be surprised how after learning how to use different instruments, you might even start loving an instrument you didn't even know you loved. But of course, there's a fine line with this statement of always being flexible, because there's a difference between a diva hygienist and a hygienist who knows what they need to properly care for their patients. If there's something you need, you can always ask for it. Of course, it's always okay to ask for things that will help you become and be a better hygienist and improve your patient care, things that will help your patients. Like if they don't have an ultrasonic scaler or something like wild like that, I think that is worth bringing up the research and why it would benefit the health of your patients, right? But again, if it's just something that is like fun, if you prefer like the pink bibs instead of the purple bibs, I wouldn't come in on your first day being like, I need this color bib, you know? You get the difference. And one last tip, number 5, if you do the shadowing day, try not to zone out. I know that sounds silly, but sometimes when you've shadowed a bunch of times, you're just kind of watching the hygienist clean teeth, and it's a relaxing thing. You're just watching and not really thinking. It's so easy to stop paying attention. So when you're doing your shadow day, try your best to think about different things that you can ask. Like all the stuff we've talked about. What happens if you feel a patient needs an SRP? How do you ask for exams? Ask the hygienist while you're shadowing. You're not there to, well, maybe you want to see how they clean teeth, but you're not really watching the clinician for their technique at this point. You're there to see how the office flows. So just keep that in mind when observing. Utilize this seasoned hygienist knowledge and ask them things. Shadowing is the time to do it. It's so much less stressful to ask things when you don't have your own schedule of patients of your own to worry about. So that's that. I hope this story time type video kind of helped you feel more confident on how to prepare for your first day of work, especially if you are a nervous person like me. Hopefully some of these tips will resonate with you and make you feel more comfortable about your new office. And having said that, one more time, I'd like to remind you all about my free RDH video checklist. If you are someone who is interested in the dental hygiene career, I made this video checklist especially for you because I get a lot of questions in the comments and messages asking for more information regarding post-graduation. So if you are interested in learning everything there is about the RDH career, be sure to click the link below. And I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And if you want even more teeth talk, you can visit my website, teethtalkgirl.com, and hang out with me on Instagram @teethtalkgirl. Peace, love, and teeth.